Guys, this is Mubin. We're talking about the general principles of the cardiovascular system. We have started hemodynamics, and the lecture today is about the velocity of the blood flow. We'll do other lectures like blood flow, the resistance, the pressure, the capacitance later on. Today, we're talking about the velocity of the blood flow. We'll talk about the formula to calculate the velocity. We'll talk about the velocity in aorta versus capillaries. We'll also talk about the significance of the velocity of the blood flow and the graphs that can actually appear in various tests. This is really important. These graphs appear in lots of places during the discussions or during the steps. So please make sure that you understand these graphs. What we'll do is that we will actually build the graphs here by doing the calculation so you understand how these graphs are formed instead of just showing you the built graph. Okay, so before we get into this lecture, let's do some, let's ground ourselves. Let's look at some things here. So first of all, is centimeter. So please pick up a ruler and look at a centimeter. What I'm going to do is I'm going to use this ruler to mark a couple of centimeters here so I can then refer them later on as we talk about the diameters of the blood vessels and their cross-sectional areas. So this is actual size 2 centimeters here on my board. The other thing that I would like us to know is 1 milliliters. So this is a teaspoon that I have in my hand. Normally teaspoons are about 5 milliliters. So I put a little bit of fluid in it, a little bit of water in it. I was going to say I have put a little bit of blood in it. So this is water, and that is about 1 milliliter. Now, what is important for hemodynamics is to be able to say how will this 1 milliliter be represented as centimeters. So this is simple. I have this 1 cubic centimeter here with me. 1 cubic centimeter. Why do we call it cubic centimeter? Because it's a cube. It is equal in all sides, and it is 1 centimeter on all sides as well. So that is a cubic centimeter. So 1 milliliter can be represented as 1 cubic centimeter. So 1 milliliter of fluid, so let's say this is the 1 milliliter, about 3 or 4 drops, can be represented as 1 cubic centimeter. So this is a cube, and 1 cubic centimeter are the same. So if I say somewhere you have 1 milliliter of blood going, I can also say that you have 1 cubic centimeter of blood going, and that would be equal to this. Cool. So that is done as well. I also have a measuring tape here with which I would like to show you what a meter looks like. So 1 meter is about a little more than 3 feet. So it's about 39 inches and 3 parts of an inch. So let me just open it up. It's about here. So this is about a meter. And I would like you to see this because as we do the diameters of the blood vessels, we'll actually come across some blood vessels which would have this kind of the diameter as well. So not this big, it would be about this big, about my arm's length. But that diameter you'll come across as well. So be mindful of that as well. And I do have a calculator here with me, so in case if I need to do some calculations, I'll do them as well. So now 1 meter, about 40 inches. 1 milliliter is about 1 centimeter cube or 1 cubic centimeter. Then next thing which we need to know is cross-sectional area. A cross-sectional area, let's say we have a pipe, and again the discussion here is not about the maths in general and the cross-sectional area of all kind of shapes. We are talking specially about the hemodynamics, and within that the cardiovascular system. Cardiovascular system can be seen as a network of tubes. Other than the heart, which is also a specialized tube, it's a network of cylindrical tubes, and we can consider them like this little glass in my hand. This glass, if it was longer, this is a longer cylinder. And a cross-sectional area is if you cut a cylinder at a plane. Now that one plane could be normal. Normal means at right angles. You cut it at right angles. It could be at not normal, that could be any other angle, and you could cut it differently, like here. So what you're seeing here is that imagine if this was a longer cylinder and we cut it at the normal, this is a circle you are seeing. The area of this circle will be called the cross-sectional area when we have cut the cylinder at its normal. Now, cross-sectional area can also be taken if you have cut the cylinder at a different angle, then this is the cross-sectional area. I've made that here. If you cut it at a normal, that is 90 degrees angle, this is the normal, then this is the cross-sectional area. Cross-sectional area, if you cut a cylinder at its normal, then the cross-sectional area is the same as the area of the circle. See, this is the cylinder. If you cut it at its normal, then the area, what are we seeing now? We are seeing a circle. So area of this cross-section should be the same as the area of a circle. So that's what we're talking about. And you know the definition of the area, the formula for the area of the circle. It doesn't matter really for doctors to know it too much, but just generally area equals pi r square. And you know that for a circle, if this is a circle, there is a thing called diameter, that is the longest chord within the circle, and then radius is half the diameter. So diameter is the longest chord and radius is half the diameter. So here we are saying a cross-sectional area equals pi r square. And I'm going to use the value of pi as 3.1415. The units of the cross-sectional area which are pertinent to us today are going to be centimeter square. Again, you can decide what units you want to work with, but within physiology, within hemodynamics, centimeter square is a decent enough unit to work with. So that is a cross-sectional area. Keep that in mind as well. Then one more difference in hemodynamics that a student must know, that is, what is the difference of velocity and flow? Look, in a pipe, velocity simply means how much distance will be covered in a unit time. So imagine if this is a pipe and this particle is moving in it, and its speed of the particle is, let's say this is 4 inches and this is 2 inch, the particle speed is 1 inch per second, 1 inch per second. That means the whole pipe will be traversed in 4 seconds. So velocity is the speed of movement of a particle. It can be speed of movement of a person, or it could be speed of movement of a particle. So here, imagine if this is RBC, and imagine if I'm the blood volume about 1 liter. If this whole thing is working together, if it is walking together, then the velocity of the RBC and the velocity of the rest of the 1 liter of the blood is the same. So velocity doesn't have much to do with the volume. Velocity has speed of movement. Now, flow is the volume. What we mean by flow is how much amount of fluid passed through a particular tube in unit time, in whatever time, 1 minute. So if we are counting in minutes, and if we want to say velocity, then what we mean is what distance will be covered in a minute. And if we are talking about the flow, then we'll say how much fluid will move through this pipe in 1 minute. So please remember, one is volume and the other one is speed of movement. Now the formula for the velocity. Formula is flow divided by cross-sectional area. Flow divided by cross-sectional area. That is the velocity. Velocity will be measured in centimeters per second. Flow, Q here, will be measured in milliliters per minute. So milliliters of blood passing per minute. And the area is in centimeter square. So that is this cross-sectional area. It is in centimeter squares. We talked about it before. Now here are a couple of things that we should understand. Look, flow is in minutes. Velocity is in seconds here. So either you make this minutes as well, or you make this seconds as well, or once you have calculated this, you convert it to seconds by dividing it by 60. So that is what we'll do over here. Second thing is, I'm going to make an assumption here for our little work here, and that is that we'll have flow of blood in 1 minute in a healthy average adult, and that will be about 5 liter of cardiac output. So we'll assume here, we're making an assumption that cardiac output is 5 milliliters of 5 liters per minute. So we're talking about an individual whose heart in 1 minute is pumping 5 liters of blood out. And of course, you should know this. As the 5 liters of blood is pumping out, it is going out through the body and then coming back to the heart. So the flow has to be 5 liters everywhere. Now, where is it flowing through? This is the aorta. This is the aorta. So here, this is aorta. The blood would enter aorta from the heart. From the aorta, it would be going to the arteries, which are branching. From the arteries, it would enter the capillaries, which are the final branches of the arteries or arterioles. They come after the arterioles. Then capillaries will merge again to make venules, and finally we'll have vein. Largest veins will come back into the heart. So that is the circuit. It is a closed circuit. There is heart attached to both ends of here. But for our discussion, this is good enough. I should mark this part here as an arteriole. Arterioles are more important for hemodynamics than the rest of the arteries. So imagine that these are arterioles. Okay. So what we want to understand is what kind of cross-sectional area. So look, the formula says that flow of blood divided by the cross-sectional area of a tube will determine the velocity. And you're seeing that velocity is directly proportional to the flow. More the flow, the more velocity. And velocity is inversely proportional to the cross-sectional area. And that means if the area is increased, the velocity would decrease. If the area is decreased, velocity would increase. What we mean is if we have the same volume of the fluid, then if you put it in a smaller size, smaller diameter blood vessel, then the flow should be different than if you put the same fluid into a larger size diameter. So that is the inverse relationship there. So let's start. Let's start with the aorta. The aorta has cross-sectional area of about 2.5 centimeters square. It is actually 2.7-ish centimeters square. I made it easy for myself. So 2.5 centimeters square, do you think that that is this? No, it is a cross-sectional area. It is not the diameter, it is not the radius, but it is a cross-sectional area. You can actually look up the radius by plugging the value 2.5 into this. So what you'll do is you'll take 2.5 and put that for A. So 2.5 centimeters square equals 3.1415 something multiplied by radius square. Right? And if you solve it, that would come to be somewhere about 1.8, about 1.8. So radius will come to be about 1.78 centimeter. What that means is that this is the the diameter. After having the radius and multiplying it with 2, you'll end up with a diameter of 1.78. So aorta is about 2 centimeter wide blood vessel. Now, about 2 centimeters. So here is the cross-sectional area. I'm going to mark 2.5. So let's say this is 0. And let's say this is 3,000 centimeters square. So aorta is somewhere over here. This is the size of aorta, really small, 2.5 centimeters square. Now, let's take that value and let's plug that into the velocity to see what is the velocity of the blood that is passing through the aorta. So velocity we know is Q over cross-sectional area, right? Now, we want to know the velocity. Q is, we have already assumed that we're talking about a healthy individual who has 5 liter cardiac output per minute. So that will mean 5,000 milliliters per minute divided by cross-sectional area is what? Here, 2.5 centimeters, 2.5 centimeters square. Now, remember this, I said a milliliter can be represented as centimeter cube or cubic centimeter. Why? Look here, I cannot divide milliliter by centimeter. I cannot divide volume by length here. So I have to have the similar units. So instead of 5000 milliliter, I could call that 1 milliliter in the form of the centimeter cube. So I'm going to do that here. So instead of saying 5000 milliliter, I'm going to say 5000 centimeter cube per minute divided by 2.5 centimeter square. If you solve that, it would come to be, let's see, it's really 5000 divided by 2.5. 5000 divided by 2.5, which is 2000. So we have about 2000 centimeter per minute. Now 2000 centimeters, centi means 100. So that means 2000 100 units. So if we divide it by 100, it would come out to be meters. So 2000 divided by 100 will be 20. So 20 meter per minute. So the blood is flowing so fast in the aorta that if you let it flow, if the aorta became long enough, then the blood in 1 minute would pass 20 meters of aorta. That's a lot of speed. If you divide it by 60, that would give you the meters or millimeters per centimeters per second. So let's do that. I'm going to pick up this 2000 and divide it by 60. And that is the 33. So if I divide this by 60, then I'll get 33 or about 30 centimeter per second. So here, velocity, if this is the 0 and this is, let's say, aorta is going to be the highest, so let's call it 30 centimeter per second, then aorta, which is the smallest diameter, is, or a small diameter, not smallest, small diameter, actually smallest, has the highest speed, 30 centimeters per second or about 20 meter per minute. That's a lot of speed. Now let's talk about arteries. Before we do the math, which is simple, what you have to understand is that as the blood vessels branch, the diameter is not looked at the individual blood vessels. So let's say this is aorta, and this is the branching of the aorta. These are the blood vessels, arteries branching. You do not say that I'm going to pick up one small artery and look at the diameter and just use that as my next artery. Instead, at one generation, you'll pick up the sum of the diameters of all of them. So if these were the 4 arteries that were coming out of aorta, you'll put them together and you'll take the sum of their cross-sectional areas, and that will be the total area that is the new cross-section for that vessels. So what you do is you take up all the arterioles or arteries, you put them together in a bundle, and then you see what is the diameter of that bundle, and that is the cross-section, and calculate the cross-sectional area. What is interesting is the capillaries. Capillaries has a cross-sectional area of about 0.6 meters. So the capillaries cross-sectional area is about 3000 centimeters square. So if you look at the cross-sectional areas, these areas would start increasing because the sum of the cross-sectional area of the blood vessels will be very large, and capillaries have the highest. So it's about 3000 centimeter square cross-sectional area, not diameter or radius. That still is about, if you put all the capillaries together, this is the diameter of the blood vessels, this big a blood vessel that they will form. And then the capillaries will come together and they'll start merging, and finally they'll become veins. So that is the kind of structure. You can actually see from here that blood flow would now start reducing, we'll see that in a second, and then start increasing. So let's calculate the blood flow in the capillaries. Capillaries blood flow. So again, the formula is the same, V equals Q over A. Capillaries cross-sectional area is about 3000 centimeters square. So let's plug the values in here. Capillaries is going to be 3000 centimeters square. The blood is 5000 centimeter cube per minute divided by 3000 centimeter square. So if you see that, it would come to be 5000 divided by 3000 is 1.6 per minute. So it is 1.6 centimeter per minute. So that is really low, 1.6 centimeter. So remember, these are the centimeters. So this is 1.6, just this much in a minute compared to 20 meter in the aorta. And if you divide it by 60, it would become, divided by 60, it is 0.027 centimeter per second. Almost you can't even see it moving. So the blood velocity would almost go down. The velocity of the travel would almost go down to 0, and then it would go back up. So what is the significance of this? The significance is this. Look, aorta is a conducting vessel. It has to bring blood to the other tissues. So it doesn't need to contain the blood in it. It needs to just pass it along. So the speed is fast. But capillaries, they need to have the blood present in them so the gaseous exchange can occur, so the water exchange can occur, so the nutritional exchange can occur. Nutrients can do their function. So because capillary are really very important functional areas, physiological areas, that is why we really reduce the blood flow through them so that the gaseous exchange and nutritional exchange can occur. So that is what we have. This is the velocity chart, this is the cross-sectional area chart, and this is the mapping to the blood arteries, and this is the way to calculate it. I hope you understand this. This is an important thing and it can be in your test. Thank you.